So, hello everyone. This is the fourth episode of MedEd Debates. In today's episode, we have Dr. Danica Sims, soon to be professor. Uh, sh She's a senior lecturer at Oxford University Department of Education. She's the course director of MSc Medical Education, and she worked on various research projects, including touching on assessment, research methodology, and also equality, diversity, inclusion in medical education. So I've learned a lot from reading her research, and she's actually one of the researchers who I inspired my default proposal from. So thank you very much, Dr. Danica, for enjoying our conversation today.
Such a pleasure. Thank you for inviting me.
So in today's MedEd Debates episode, we're going to be discussing assessment, stressful experience for a lot of people, I'd say, especially in Syria, since assessment is synonymous with failed tasks kind
Mm.
of experience, where it's just like you need to pass it in order to get to the next stage. So let's start with a softball question. What do you think is the role of assessment, or what should it
Sure.
be?
Sure. So I would hopefully want to expand the definition to think sort of to move us past thinking about assessment as a negative experience where you need to sort of cram for an exam, just sort of bring up all that information and then you promptly forget about it when you leave the room. I want you to see assessment as serving sort of many different purposes. It's not just about that sort of final exit decision. So that would be certification, for example, in the health professions. It's also meant to encourage students to learn and to develop. So not just in terms of developing their knowledge and their clinical skills, but also I would say their value system. So who are they as a professional? How can they sort of become a certain type of health professional in the future?
Okay, so you talked developing values. So I'm trying to recall the times where I developed values in like when I'm doing assessment here in Syria, but it's hard to recall any of that. So how can assessment develop values?
I think that's
Just
probably one of the greatest disconnects in assessment. I think we focus so much on the knowledge and the skills that we forget about the attitudes and I would say the underlying values. So it's very challenging to develop that, and I don't have a quick and easy answer. I think that those who are in charge of designing education systems and assessment programs need to take a step back and first think, what is the value system of this educational offering? So, what kind of values do you want a Syrian healthcare worker to have? And go right back down to basics. And once you have those sort of foundational values, then you build up everything else. But I feel like often we build the house without the foundation. And you need to make sure that you're producing a type of health professional that's actually going to meet your unique context and the needs that you have within Syria.
yeah. So touching on a very important point that you've mentioned in your answer, who should design assessment? Who
I believe that
should
assessment.
doctors?
Yeah, so there's many diverse stakeholders involved in assessment design. So definitely health professionals should be involved. I would say you could even bring in sort of patients, you can bring in students, you can bring in other stakeholders, whether it's your sort of government organizations or professional bodies. I think you need to be balancing a number of different stakeholder perspectives, but it should be collaboratively developed. It shouldn't just be sort of one group dictating this is the way we do it. I think you need to consider a multitude of perspectives.
And what are the skills needed for developing an assessment? You can't just have anyone come in and just design an assessment, even though like they can be like amazing in their field. But what if they lack assessment literacy?
Yes, so I would say assessment design is multi-stage. So I would involve sort of a diversity of stakeholders at the beginning. But then when it comes to sort of also making sure that's educationally sound or rigorous or valid, then you do need those with assessment literacy to come in and sort of make those valid decisions, so defensible decisions, or else again, it's not anything goes. It's about considering everyone's feedback and based on that sort of broader voice, then making sure that you're sort of meeting their needs, but also balancing it with sort of educational robustness and making sure that your assessment system is indeed aligned to sort of best practice or evidence.
You've mentioned a very interesting point. You should involve a student in the assessment. I've yet have to experience this or like witness this. So how could a student help in designing an assessment?
I think that understanding the experience of those who actually experience assessment is very important. Often, even when it comes to curriculum, you can design a curriculum, but how it's implemented and how it's experienced can be very different. So I think that those who are actually doing the assessment, they should have their voice included. I'm not saying they're going to be the experts, that they have perfect assessment literacy, but they do have valid experiences which can inform sort of how we design assessment, what we do, how we structure it, the tools that we're using. I think fairness and so, you mentioned equity, diversity, and inclusivity. I think we need to be considering our diverse sort of student population and making sure that we're not sort of ignoring their experiences of assessment when it comes to actually doing it.
Yeah, that's very interesting. And on another point, a patient. What could be a role of a patient in an assessment practice?
Yeah, so I think if you're looking at adopting a longer term perspective on assessment, ultimately, in at least within the health professions, assessment is certifying that someone is safe to practice in public. So that means that the patient is at stake. And so I think if that's the sort of end user or the end stakeholder, their experiences again should be brought in. So for example, if you're trying to create a certain type of health professional and that graduate isn't sort of meeting patient needs, then that patient feedback is very valuable and it should directly inform your whole educational system to make sure that are you producing health professionals that are actually meeting patients as they need to be met.
Yeah, but patients are very diverse, and like we'd say, one patient wouldn't mind anything, and the other patient would, would be too scrupulous and like would take notes on everything that you do, and like, how could isn't it too variable to be learned from?
Again, you can't necessarily bring in everybody's perspective, but it's still valuable to listen to everyone's experiences. So even if it's a minority, it could still reveal sort of a very important gap in training. So we would hope that the vast majority of patients would be satisfied with patient care, but I'm sure many are not. And even if it's a minority, you should still be able to hear about their experiences and let that inform to varying degrees. It doesn't mean necessarily completely changing your assessment system. It might, but again, I think that constant feedback and that constant idea that assessment systems need to evolve and adapt and innovate should be part of your sort of broader assessment design.
Thank you very much. Uh, you've talked a little bit briefly about this. You've mentioned this in your answer, but I want to know what are the pillars of the quality assurance of assessment? How do we know that assessment is, let's say, good?
Yes, that's, I think, probably one of the most important, if not the most important question. It needs to be valid. So, if you want to produce a certain type of health professional, are you actually achieving that outcome? It needs to be reliable. So, sort of from student group to year on year to different sites, are you sort of producing again the same type of outcome? Is it educationally impactful? So, how is learning at the assessment actually shaping student learning? And then I guess sort of the big but is it needs to be feasible. So you can, of course, design an ideal assessment system, but at the end of the day, it needs to be practically achievable within a certain context. And I think that also speaks to your previous question about the patient and the student. We talk about acceptability. So stakeholders, while you might not be perfectly happy with the assessment system design, hopefully there's some sort of negotiation and compromise where everyone is accepting it to a certain degree and everyone's sort of bought into that design. And so that links to feasibility. If no one's happy, you might have a really good system because everyone's sort of had to have compromise. Yeah.
Yeah. So let's imagine a little bit of a dystopian scenario, whereas like validity is compromised, reliability is low, educational impact is non-existent, and the feasibility is quite high. It's quite easy to do. It's quite easy to apply. But as I said, on like more on top of that, it's like in terms of fairness, it's also not very fair.
Mm.
What are the implications of a system that have that of assessment system that has these qualities?
I mean, again, because assessment serves multiple purposes, you won't be sort of achieving those purposes. And then I guess the sort of the downstream effects of that is, what type of knowledge, skills, attitudes, values are health professionals actually developing? How are they going to practice in healthcare? How's it going to impact on sort of patient care and public health? I think those are sort of the downstream effects. So I think assessment is the most important part of any educational system. It's critical to actually ensuring that you're achieving what you're setting out to achieve. And if you don't do that, then what's the point?
Yeah, but uh, our our role as educators, and we're teaching medical students and health professionals, and if the system is this compromised, aren't we just also compromising patient safety?
Yes.
Yeah.
Yeah.
So definitely. So exit exams. Let's talk about exit exams. They're fun actually because I think the UK is now transitioning to medical licensing exam.
Licensing assessment,
The,
yeah.
yeah, did they start with it or not
I think they're
yet?
starting this year. They might have piloted it last year, or if not, I think they're piloting it this year and then sort of rolling it out nationally very soon.
It's supposed to replace PLABs as well for international
Yes.
medical graduates. So
Yes.
all students are supposed to take the same exam, which is quite a good step, I'd say, in terms
I mean,
of
standardization, yeah, standardization is really important, especially for sort of ensuring that you have a competent or a safe healthcare workforce. But I suppose standardization within a national context is a good idea. I'm not sort of proclaiming like a global or a universal standardization. I'm quite against that. I think that assessment should definitely be contextualized and sort of contextually responsive and locally driven to make sure that, again, you're producing health professionals that actually meet the need within your country and not sort of for a necessarily a global health field.
yeah. So we have an exam. We have an exit exam at our, medical and uh, dentistry schools and stuff. It's called the National Medical Examination, National Dental Examination, and there is a national examination for also pharmacists. Um, but the exam, although it can be multiple parts for the medical school, it's multiple parts. It's usually two parts. For the for the dental school, it's one part. It's 120 questions, MCQ questions that usually last for 2 hours. Uh, I have yet to read about evidence of its validity and reliability, but informal reports from students and informal feedback tells that there is a lot of variance in it, especially because different medical schools in CR teach different things, but
Mm,
those are responsible for the assessment design come from a certain school, let's say. So students at that school would be disadvantaged
yeah.
by this. So, and this is the exit exam. This is the exam that tells you you are now ready to be a doctor and treat a patient. Uh, what do you think are the implications for having an exam like this?
So personally, I'm not a big fan of sort of single high stakes assessment. So, like having a huge decision right on a single data point. I think that it's more reliable and robust and defensible to make decisions based on sort of an aggregation of data. So, there's a model called programmatic assessment, and that's kind of one of the main ideas. But even though programmatic assessment, I say, is not a very feasible type of assessment, it's quite resource intense. I think the principle still applies, and something like a portfolio could be a more sort of low resourced assessment tool where I think again you're making a decision based on sort of a collection of evidence as opposed to this is one sort of assessment opportunity and everything's riding on this. I don't find that a potentially good form of assessment. But that's just one perspective. Again, like I think if there's a standardized assessment that can be useful. But I would prefer to make decisions on sort of more of a holistic profile of someone's performance than just one point in time.
Yeah, and I want to ask about another thing. The score of the National Medical Examination is comprises of 50% of the total score of the student, and there is also 50% that is aggregate score across the years.
Yeah.
Uh, Based on this score, like 50% to 50%, students are allocated to specialties. The best
Oh,
specialties like dermatology, cardiology are right in the top, and like cosmetic surgery right at the top, and like lower specialties like let's say radiology and lab medicine are, not that high. So people get very competitive to like raise their scores as much as possible to get into the specialty they want.
Yeah.
So, what do you think of having your dream specialty conditioned on
Yeah.
the fact that you need to score higher uh, on both of these exams? And like, shouldn't we allow students to pursue their dream, especially because they want that? They will work
Yeah.
hard on it. They will, uh, develop and become great ones. Uh, so what do you think? What's your take on this?
I think I agree with you. I'm not really a fan of reducing a complex human being with all of their skills, knowledges, and values to a single score. And I found it interesting that you described specialties in a hierarchical manner, like some are better than others, and some require, I don't know, smarter graduates than others. I find that a very interesting idea. And not one I particularly agree with. So I understand the idea of sort of supply and demand and, being competitive. And I think that speaks more to like a norm referencing model where, again, you're ranking yourself against others as opposed to a criterion referencing model where you're sort of looking at how students are performing according to a set standard as opposed to, if you're performing better than I am. Like, no, have we both reached the desired standard? Are we both sort of safe practitioners? So again, I think that's bringing in different value systems and potentially different sort of goals for assessment. And that's not how I would design an assessment system. That's not the goal I would have in mind.
So what is an alternative model? Let's say you're being exposed to the, UK model. What is an alternative model for allocating, let's say, medical graduates to their to specialties?
I suppose for me, I don't have an ideal model. Again, trying to be sort of more of a pragmatist. I understand that. And I think this is more of a global phenomenon where there are simply limited places. So while in an ideal world, I'd love for everybody to be able to pursue their dream. If you want to undertake a certain specialty, like go for it. I think the challenge is because there are so few places, it makes it very competitive. And I guess one of the defaults is looking at someone's scores. If it is a competitive system, I would again bring in sort of more assessment tools. So having, for example, an interview. Um, Often I don't find somebody's transcripts particularly useful, the information I'm gathering. It's demonstrating one type of sort of competency. But I find interviews, even for our master's program, very revealing and almost more important, looking at their personal statement, reading the reference letters, speaking to a potential applicant and sort of understanding who they are as a person, how they think, are they a lifelong learner, are they open to learning? For me, that is the information is sort of more valid, it's more meaningful, and it definitely holds more weight in my decision making than opposed to looking at someone's grades or scores from exams or anything like that.
That's a wonderful idea. It's like it seems very valid for its purpose. Like you could find people who are, for example, very enthusiastic about certain specialty in their interview. You can find like you can touch on their passion and like how
Exactly.
excited they are to work on this like specialty. And like you definitely allocate this person, you give them, let's say, preference to this seat in this specialty. Let's say uh beyond others because they have potential. Although their scores
Yeah,
are not there yet, they have potential to develop a lot over the years in this specific specialty. Whereas, you're losing all that passion, you're losing all this high potential if you place them
yeah,
somewhere else. So yeah,
exactly.
definitely, definitely. Uh, so one last question before we end the interview, before we end the debate, is having experienced some, assessment reform in South Africa, what do you think the first step that we need to take in order to reform assessment practices in Syria?
Oh, well, again, a very challenging question. I think it comes back to, I think, one of my earlier answers about stakeholder involvement. So I think it's about understanding perspectives on the ground and experiences on the ground and making sure that whatever you're doing is contextualized and it's actually aligned to your needs and your population. So when it comes to South Africa, we did a study where we looked at universities' assessment policies. So I would say if you, I mean, I'm sure it's similar in Syria and sort of worldwide, where universities are basically autonomous. They can mostly do what they want to a certain degree. Yes, there's sort of regulatory bodies, but there is a degree of independence. And so we looked at sort of three universities and what their assessment policies were. And these are just documents which are explicitly stating, what are their assessment values? What are their assessment principles? And for then academics to use these policies to guide their own assessment design. So again, I don't really believe in a prescriptive approach. There's no sort of hard and fast rules. I think there's principles, making sure those principles are sort of evidence-based and valid and theoretically rooted, but again, acceptable to the stakeholders and making sure that it's actually being applied in your context. But what I really liked about these assessment policies was the inclusion of student voice and the recognition of diversity in student learners, which is obviously something big in South Africa, and I'm sure it's, again, globally relevant. So I think if you don't have an assessment policy document, sort of collaboratively creating policies and sort of comparing across institutions would be a great way to start so that you have sort of an explicit outline. This is what we believe about assessment. This is how we sort of recommend it could be done. But again, how you apply it in your own setting might look slightly different. And then, based on that, you could always put together some sort of national framework within your organization, for example, where you're bringing lots of different healthcare workers from across the country and getting their sort of input. I think that would be a valuable first step.
This is the best answer I've got on this question. You don't know how many times I've asked this question to many doctors here in like Syria and like many educationalists, and each time the this usually the similar answer would be to have another a curriculum or a assessment
Mm,
policy from another medical school in like say America or like the UK or Europe and like implement it like take it right from there and implement it here in Syria. Whereas I find like there are a lot of problems and issues will arise from that because the context is so very different and the goal is so different. You don't have European patients, you have Syrian patients, Syrian values, and like Syrian students. You don't have
yeah,
European students. So definitely I agree with you. Like we should start with the principles and
yeah.
draw our assessment policies based on like say our specific context.
Exactly. And again, you can't consult, like, if you're welcome to look at what they do in the US or the UK, but for me, that's not the global authority. It's useful, look at it, but then always come back to what do you need in your context? I think that's the most important. If you can have a contextually responsive assessment practice, I think you're at a good starting point.
Thank you. Thank you very much. Well, this has been a fun debate, actually. Thank you very much. Thank you very much, Dr. Danica, for like joining us here today. And thank you for
Such
your
a pleasure.
expertise and time.
Thank you. Thank you.